Mr. Kurtz, you've had the problem with the double vision for quite some time after your head injury. We've given you 6 months for this to resolve, and it really hasn't. So the next step is to move some of the eye muscles. We do that in the operating room with you asleep. In your case, we're going to have to move one muscle in each eye. We move them a few millimeters, we can get the eye lined up again, and if we line the eye up in space, the brain will be able to fuse again, get you single binocular vision in an area of three-dimensional area of space in front of you. That's what we're really after here. The procedure takes about 15 to 30 minutes to perform. We do it with you asleep, as I said. You have to come into the preoperative area about an hour and 15 minutes ahead of time, and they keep you for about a half hour afterwards. You have to have a driver, and afterwards you're going to have a patch on one of the eyes. Here you'll be able to see. We'll take one patch off and leave one on. We'll see you the next day, and then we see you about a week after that, and then in a couple weeks after that. Immediately following the surgery the next day, the double vision is a little bit different. It has to have a little time to heal and sink in, so it's very important that you bring your glasses along with you the next day, because we're going to be changing the prism, keep things lined up. And as you heal, we're going to be starting you on some exercises to try to keep things focused so that it doesn't drift away from where we've set your eyes. This is about 90% successful. In a few patients, we have to bring you back and do more surgery. But it's clearly the thing to do at this point, because the prisms aren't offering you enough of this three-dimensional area of space to which you can see single. Do you have any questions for us?
Could this ever come back again?
Well, in your case, you had this from a head injury here. And so I don't expect this to come back. What could happen is, if we don't do the exercises and the rehabilitation after the surgery, it could drift off to a new angle here. And so, just as the surgery is important, our care afterwards is equally important.
As an exercise, something I do at home, do I come back to the clinic?
Well, they're the same exercises that we've had you on before. They're fusional exercises, and you'll be doing them at home.
Okay. And as a medication?
We'll give you some ointment afterwards, which has an antibiotic and a steroid in it, and some pain pills. We give you enough for about 5 days afterwards. Most people don't have very much pain at all. You will, however, have a red eye. That'll be kind of red for about 2 weeks or so. You'll be able to go to work in a couple days after the surgery.
Do I need to avoid the sun or anything? Just
No,
the red eye?
I would do whatever you need to do.
Okay. And how soon do I need to take care of this?
In your case, we could do it any time in the next month or so. If you waited longer than that, we would want to remeasure you, because the change could be different.
I'd rather take care of this now.
All right, well then I'm going to have you talk with Kyle, our surgery coordinator, and see what she can do about scheduling it.
Awesome. Thank you, doctor.
Very good.
Thank
Come
you
on
so
out
much.
with me and I'll take you over to Kyle.
Awesome. Thank you.